Late Night Health continues. I'm Mark Allen, the insane Darryl Wayne, twiddling the dials and keeping us moving straight. We are not serving venison or deer. Do not write that. We shot it with a video camera. It was one of the most exciting times that I've ever seen in all the years I've been shooting video. It's just, it really fantastic stuff. Our guest is Dr. Ron Fischbach. We're talking about the truth about healthcare. I recently looked some statistics up to see where we ranked in terms of healthcare. And we're like number 35 to 40 in that area.
That's right. That's right.
In terms of money spent per capita.
The problem that we face is that we are a very diverse society, meaning that we are diverse in terms of what our expectations are of health care, and diverse in terms of our income levels. And so if you take a society like ours, it's difficult to compete with a society which is more distributed more evenly in terms of expectations and income. So you're absolutely right, but that's not an excuse. We need to design our healthcare system to meet our needs. And so far, we are seemingly designing it to meet the needs of those who are not necessarily going to use it.
But make money from
it. Right. And that really brings us to one of the essentials of what's wrong with our system. When you go to the doctor, and the doctor looks at you and decides what he can or she can help you with, they do so with the idea in mind of how much will this make us? Now, that's not the sole thing. Of course, they're good people and they care about people. But if one test will do it, two tests will do it better. And if two tests will do it better, maybe a third one will do it even better than that.
Well, doctors are no longer allowed to get commissions, we'll call them, from tests. They're not allowed to outright own testing facilities. However, if you're in a hospital, that's different.
Well, let me tell you, I was in the hospital for one day, about a month ago, and I got a hold of the bill. And the bill, not what I paid, thank goodness, but the bill was a little over $57,000 for one day. Okay? Now, when I looked at it, I saw things that I didn't call for, that my doctor, I am certain, did not call for. And I'm questioning the bill. When I went to question the bill, they asked me, why are you worried about this? You didn't pay anything. I said, that's not the point. And they didn't know that my background was public health. And so I come from a perspective which is called, what's the common good? What is good for the most people, since we all live on this same planet?
Absolutely. The same thing, glasses. And Daryl's heard this story. The three of us all wear glasses, eyeglasses. So 3 or 4 years ago, I went in, I got a prescription and sat down to get a pair of glasses with the optometrist. And they showed me the bill for the glasses I selected was like $650. And I said, gee, the last time I got glasses at Costco, they were $300 for the same kind of thing. Could you recheck that? And they said, Mark, we just have to show you that. It's not going to cost you $650.
That's right. That's exactly the point.
And I said, how much is it going to cost me? And it was like $500. And I said, wait a second. I have a $300 payment toward the glasses and the lenses. Shouldn't it show me $350? And they said, oh, no, that doesn't work that way. We have to mark it up so that we can get what we want. And I've talked to my primary care physician, who's an MD, but with a holistic bent. And he said, it's the billing companies do it for us.
See, it's an unholy alliance. The alliance is not well understood by the patient. The patient looks at the bill and says, thank goodness I'm only paying whatever percentage it is. And they say, after all, the insurance company will be responsible for the rest of it, not realizing, no, we are all responsible in increased insurance costs. And that's something that's missed.
As we get older, and as America ages and grays, we need hearing aids, we need glasses, we need dental procedures. And these are pretty simple and basic things. Some of them are not covered and should be covered, like hearing aids.
How about mental health?
Mental
health is a very much of a poor cousin to physical health. And we are paying the price for that in many, many other ways. Increased divorce rates, increased homicides,
increased
suicides, enormous problems.
And increased people just going ballistic and killing people, like in Orlando, or having such a one-sided view of life that they go out and they kill a bunch of people.
But look how quickly we added to our vocabulary going postal.
Going postal. I was going to use that, but decided not to, but I'm glad you did. Ron, will you come back?
I sure will.
All right, good. So Ron Fischbach is joining our family, Daryl. Take his wallet on the way out. I'm Mark Allen, along with Daryl Wayne. Ron Fischbach has been our guest. Join us at latenighthealth.com, latenighthealth.com. Brand new website. I think you're going to enjoy it. Gary Allen up next, an actor who took time off to take care of his aging parents before they passed. We'll be talking to Gary in just a couple of moments as Late Night Health continues.
Ron's done a lot of college. I'm sure he'll understand the hazing procedure.
That's right.